Hello guys, this is Dr. C here, day 9, Done is Perfect Challenge, the sacral bone. We are talking about this bone right here, okay, which is the keystone of the pelvis. Basically, all of the spine, all of the spinal segments are supported or on top of this triangular bone, okay? So this bone, even in the anatomical models, they are like fused, like one entire segment. This bone is like in different portions or different pieces until we are 25 years old. This bone have these different nerve endings right here that comes out and connect here superficial for the sensory portion of the nervous system, and inside these fibers right here connects to the autonomic portion, like for the visceral organs that connect from here. And we're gonna talk about that as well. The important thing to know at this point is this bone in here is supposed to be fused, but in some youngers this bone is not fused yet. So we have different segments right here, okay? If we have traumas, if we have any type of accident, any falls, anything that can affect the nerves, if the bone gets fused, so that bone is not gonna fuse. That is the innate intelligence in the human body. So, and some people have these segments open wide in the back, like moving that way. And in that case, particularly, I had an experience with an instructor that he was even paralyzed because this bone was open right here, okay? So pay attention to your posture. Yesterday I was talking about the posture when we are driving, and not just for driving, this is for all the time when we are sitting. Some people sit with the pelvis like shifting to the front like that. That is not good. That is gonna put pressure on the ligaments down here, and it's gonna start damaging with early degenerative changes right here, the joints in the lumbar spine as well, okay? So let's talk about the 3 different components of the nervous system that controls the sacrum. The parasympathetic portion basically is the most important part to understand here, and the parasympathetic deals with the autonomic portion of the nervous system. We are talking basically about these 3 segments, S2, S3, and S4. They controls basically the reproductive organs, mostly in the males control ejaculation, as well the prostate gland, and in general for females and males the urethra and the prostate and the bladder as well. Then also the rectum, the sigmoid colon, the descending colon, and the transverse colon as well. Okay, so that is for the portion for the autonomic nervous system regarding the sacrum. Let's talk about the sensory, what we feel in this area, okay, which is related to these nerves right here. We have this graphic in here. This is more detail that controls sensory sensations all in this area right here, around here, okay? So that's for the sensory portion. And also the sensory portion is basically distributed in sacral segment number 1, which is sensory, or what we feel, in the lateral portion of the knee in the back, and down to the toes, okay, for the plantar superficie, so for the plantar surface as well, okay? That's segment number 1. Segment number 2 is in the middle of the calf and in the center, in the abductor muscles area as well. Sacral number 3 is in the perianal area, and then also in the pubic area, and the perianal, it's called the perineum, that area in between as well. That's what we feel. When we have sensory disturbance, we're gonna have something called cauda equina. Cauda equina is something that is something that you have to go to the emergency room. If you have a subtle anesthesia distribution pain, like you feel numb all this area, you need to go to the ER immediately. That's the worst situation that a person can present in this area if they have any type of sensory issues around that area. Okay, so don't play with that. If the person have autonomic issues with the sacral bone, with the sacral nerves, they're gonna have problems even in the reproductive organ in the females. I have heard, and there are research that explain that this can represent even infertility in the woman and the male as well. Okay, prostate gland is gonna be defective if it's not connected properly to the sacral segments as well in the nervous system. The bladder, we're gonna present maybe the wet bedding at night for the kids, or lack of control for the bladder or urethra as well. And then in the rectum and this area of the large intestine, we're gonna present a constipation, irritable bowel. Any type of situation can happen or alteration can happen if these nerves are not 100% in control, coming from here, from the sacrum. Okay. Also, the last portion is gonna be the motor. The motor means the muscles. The muscles, mostly from the sacrum, are gonna be controlled by S1, and for that, basically, are kind of following the same distribution right in here. It's gonna be the patient that has issues in the sacral bone, in the motor portion, probably is gonna have weakness to do a toe tips walk. So this type of fashion right here is gonna be a limitation in people that is having issues with the sacral bone as well, with the nerves in that area, with the motor portion. So if you can see kids that are walking like with the toes in, like that, that's probably because they have the sacral bone number 2 that is pushed out already. Okay, so be careful with that and make sure that your family, your loved ones, they are aligned and they don't have any issues that can affect or alter in any way the development of the normal or natural nervous system. Okay, so this is Dr. C. If you have any other questions or suggestions, just let us know. For now, those are the basics from the sacral bone. As well, the sacrum is related to blood pressure, mostly for the diastolic one, which is the dangerous one. So there are research out there studying that the sacral bone is also related to blood pressure, to high blood pressure, mostly for that one, for this diastolic. So that's the information that I have for today, guys. So you can subscribe, and if you like the video, hit the like button, and see you tomorrow then. Have a great day. Bye-bye.